our health systems and societies, as well as the reputation of our organization. To my surprise, I have learned recently that the last Edelman Trust Barometer survey shows that the WHO is still the most trusted multilateral organization. I see this as a vote of confidence, but also as a responsibility to be transparent and keep working hard in promoting health, keeping the world safe and saving the vulnerable. There are quite a few challenges on our hands, to put it mildly. We have a heavy agenda ahead of us with 47 items and sub-items to be discussed, and over 20 resolutions and decisions to be adopted. Some of the items have already benefited from fruitful discussions during the Program Budget and Administrative Committee meeting last week, under the excellent leadership of the PBAC chair, Ms. Aishat Rishnei. I'm looking forward to the report tomorrow. It will certainly make our work better focused and shorten our discussions. Other, more technical items will still need our full consideration in the next 8 days. Let me, at this point, refer to a very productive informal EB retreat in November last year, where we have discussed how to ensure that our discussions are more focused and concise, which is also in line with the Agile Member State Task Group recommendations. Some of the ideas were reflected in the guidelines sent to you earlier this month. Let me sum up for you those most important. First, we are all encouraged to be concise when taking the floor and focus on the guiding questions provided in the reports of the Secretariat. We will have these guiding questions projected on the screen during our debates. Second, I hope that many of you have posted online your written statements for all of us to be able to read them in advance and to take them into consideration for our discussions. You can still post your written statements on the WHO website, or if you have a longer statement with the information you would like to share additionally, you may send it to the email address statements@who.int. and share with us only the most important points orally. Please be reminded that written statements will not be included in the summary record of the meeting. All the introductions, anyway, are in the informal note you have received from the Secretariat in preparation for the meeting. It is my hope that these innovations will allow for a more dynamic and meaningful discussion and at the same time for sharing good practice and experience from your national context. At the retreat, we have also discussed how to best engage NGOs and civil society in the work of our governing bodies. They are crucial in identifying the needs of our populations and in particular the needs of those most vulnerable. Civil society is also important when it comes to the implementation on the ground and for ensuring that nobody is left behind. They are thus also encouraged to share their views and knowledge in a written form in advance. It is very important for us EB members to be able to take in consideration statements of non-state actors. I also want to share with you that there has been a session of the first WHO Youth Council meeting on Saturday. They are still around today and looking forward to talking to you, EB members. I believe their views can enrich our discussions. Before finishing my opening remarks, I wanted to wholeheartedly thank all of you, my fellow EB members, and the Secretariat team for all the invaluable support during my chairing so far. I truly count on you, since only together we can make a progress. I would also like to address a special welcome to 7 new members of the board. From Canada, Mr. Nicolas Palanque. From Colombia, Sir Jaime Hernan Urrego Rodriguez. From Japan, Dr. Yasuhiro Suzuki. From Malaysia, Dr. Zaliha Mustafa. From Oman, Dr. Hilal Ali Hilal Al-Sabti. From Peru, Dr. Rosa Guterres Palomino. From Rwanda, Dr. Sabin Nsanzimana. I cordially greet all representatives of member states, also observers, the United Nations, various United Nations bodies and specialized agencies, other intergovernmental organizations and non-state actors in official relations with WHO, whose participation is further evidence of the close relations between WHO and these organizations. Finally, welcome to our Secretariat colleagues who are following and supporting the deliberations of this meeting, and thank you, interpreters, for enabling us to understand each other. Now, let us turn to the consideration of the agenda for this session of the board. In accordance with the provisions of the rules of procedure, the board has before it this session's provisional agenda, which is contained in document AB 152/1 and AB 152/1 annotated. In accordance with Rule 8 of Rules of Procedure of the Executive Board, the officers of the board met with the Director General on 14 October 2022 to review the draft provisional agenda of the 152nd session of the board that had been circulated to member states on 27th June 2020. Proposals received from member states by the deadline of 19 September were considered, and the provisional agenda was agreed by the officers of the board. At this time, I would like to propose the deletion of the following agenda item, as I understand it is not needed. Item 24.1, Independent Expert Oversight Advisory Committee membership. This is being proposed for deletions since there are not any proposals on membership that have been put forward for the consideration of the board. May I take it that this proposal is acceptable? As I see no objection, it is so decided. Are there any further comments on the provisional agenda? I see Denmark. Denmark, the floor is yours.
Thank you, Chair. DG, fellow members of the Executive Board, colleagues, the European Union works closely with the World Health Organization on a wide range of subjects within the European region and on a global level. As agreed in the exchange of letters in 2000 between the WHO and the European Commission concerning the consolidation and intensification of cooperation, and without prejudice to any future conclusion of a general agreement between the WHO and the European Union, the European Union delegation attends the meetings of the Executive Board as an observer. As in previous EP meetings, we ask the Executive Board to kindly agree that the European Union delegation is also invited to attend and participate without vote in the deliberations of the meetings of its committees and subcommittees, drafting groups, or other subdivisions thereof, in addressing matters falling within Union competence at this 152nd session of the Executive Board. Thank you, Chair.
Thank you, Denmark. If there are no further objections or comments, I think the agenda is adopted. It is adopted now. So let us now turn to two matters related to the officers of the board. First, board members may recall that at EB 151, in May 2022, Mr. German Escobar Morales of Colombia and Mr. Khairi Jamuluddin of Malaysia were elected as vice chairs from the region of the Americas and the region of the Western Pacific, respectively. Since then, I understand that Mr. German Escobar Morales and Mr. Khairi Jamuluddin are no longer available to serve in these positions. I understand that the region of the Americas and the region of the Western Pacific have consulted and proposed that Mr. Jaime Hernan Urrego Rodriguez, Herman Urrego Rodriguez of Colombia and Dr. Zaliha Mustafa of Malaysia be elected as vice chairs. Do I take that the board agrees with this proposal? Thank you. I can see that you do agree. Additionally, I would like to inform you that the region of Americas has brought to my attention a concern related to the lack of a formal mechanism to replace the officers of the Executive Board during the intersessional period, should they be unable to complete their term pending a decision of the Executive Board. Given the need to ensure an informed and full discussion of this matter, and taking into account the ongoing processes of existing reform, I would propose that this matter be considered in that context at the next meeting of the EB, without prejudice to the possibility for EB members to further discuss it at the next EB retreat. May I take this approach as unacceptable to the board? I can see that you are with me, so there is no objection to it, and is so decided then. As you know, EB 152 has a heavy agenda, as I mentioned before, with 47 items and sub-items and more than 30 draft resolutions and decisions to be considered. It is important that we hold the meeting in a constructive manner. Once again, please post longer statements online and focus your oral interventions on the guiding questions projected on the screen. It is still possible to post your statements, the longer ones, online. I encourage you, EB members, to limit your interventions to 3 minutes. Individual statements by all member states not represented on the board and associate members will be limited to 2 minutes. Statements by observers, invite representatives of UN and other participating intergovernmental organizations and of non-state actors in official relations with WHO will be limited to 1 minute. But also, all of you can have your interventions posted. Regional and group statements will be limited to 4 minutes. I would also like to inform you that, as agreed, constituency statements by non-state actors in official relations will continue to be trailed during this meeting and will be provided on the following selected agenda items. Item 5, universal health coverage, reorienting health systems to primary health care as a resilient foundation for universal health coverage and preparations for a high-level meeting of the United Nations General Assembly on universal health coverage. Item 12.1, strengthening WHO preparedness for and response to health emergencies, strengthening the global architecture for health emergency preparedness, response, and resilience. Item 14, well-being and health promotion, and item 16, social determinants of health. Constituency statements will be limited to 3 minutes and will be delivered after all EB members intermingled throughout the discussions. When we move to the agenda items considered last week by the PBAC, I propose to build on the good work of the committee by focusing on discussion on the PBAC report and its recommendations, rather than having another full discussion of each of the documents. With the intention to ensure for all of us some rest every day, I will be very strict with time limits, and I ask you for your understanding. May I take it that these proposals are acceptable? Is there any comment? I see Germany. Germany, the floor is yours.
Thank you, Chair, for giving us this unusual opportunity to speak before the DG. First of all, we would like to congratulate you on your election as EB Chair. Germany would like to take the floor to express our confidence that your leadership, Madam Chair, will provide a meaningful oversight by steering the debate. We have discussed, and we will be discussing during this EB, many reform aspects in order to improve governance and to increase transparency, efficiency, and accountability. We are confident that the guiding questions will allow a more interactive debate and in particular will provide high-level oversight and guidance to the Secretariat on Member States' expectations. A conclusion of the main findings will allow us to follow up on how the Secretariat has been implementing our common will. We look forward to productive and interactive discussions during the next days. Thank you very much.
Thank you, Germany. Thank you for supporting me. If there are no other comments, I think the methods of work have been decided. Let us now review the preliminary daily timetable contained in document EB 152, DIV/2. It is proposed that the board meet each day from 10 to 13 and from 14:30 to 17:30. Some items are proposed to be discussed at fixed times. This morning, following the conclusion of item 1, the board will consider item 2, report by the Director General, which will be followed by item 3, report of the regional committees to the Executive Board. The board will then turn to the first bullet under the item 12.1, strengthening WHO preparedness for and response to health emergencies, strengthening the global architecture for health emergencies preparedness, response, and resilience. This information, this afternoon at 14:30, the board will consider item 25.1, appointment of the Regional Director for the Americas. The first session will be a private meeting at which a secret ballot will be taken on the appointment of the Regional Director for the Americas. Upon confirmation, the reading of the oath and signing of the relevant documents will take place in a public meeting. Thereafter, consideration of this item will be suspended to permit the incoming Regional Director to join the meeting in person in Geneva. Following this, the board will return to the first bullet under item 12.1, strengthening WHO preparedness for and response for health emergencies, strengthening global architecture for health emergency preparedness, response, and resilience. On Tuesday, 31st of January, at 10, the board will consider item 4, report of the Program Budget and Administration Committee of the Executive Board, followed by item 20, budget and finance matters, including the discussion on sub-item 20.1, financing and implementation of the program budget 2022-2023 and outlook on financing of the program budget 2024-2025. And sub-item 20.2, proposed budget, program budget 2024-2025. On Monday, 6th of February at 10, the board will consider item 23.1, matters emanating from the Working Group on Sustainable Financing, including the discussion on the AMSTG report and the Secretariat Implementation Plan on Reform. On Monday, the same day, 6th of February, at 14:30, the board will return to submit to sub-item 25.1, appointment of the Regional Director for the Americas. Any statements on this item would be taken at this time, and regional or group statements are encouraged. This was originally programmed at 10 on 7th February, but to accommodate a virtual link with PAHO, we are proposing to shift to the afternoon on Monday. Finally, with respect to item 25.4, human resources, I would like to inform you that document EB 152/55, the Secretariat's report on the possible convocation of the special session of the Executive Board will be considered on Saturday, 4th February at 10. Exceptionally, I propose that this matter be considered by the board in the restricted meeting, in accordance with Rule 7C of the Rules of Procedure of the board, and that the discussions be therefore confidential. This reflects the sensitive nature of the subject matter, as it is necessary to enable us to discuss this matter without compromising the integrity of the related procedure. To protect the confidentiality of the discussions, I propose that attendance at the restricted meeting be limited to members of the board, their alternates, and advisors. One representative of each member state not represented on the board, and of each associated member, as well as essential Secretariat staff only. The meeting will not be open to observers, intergovernmental organizations, non-state actors, and the public. Furthermore, the meeting will not be broadcast on the WHO website, and no official record of it will be made. The outcome will be announced in a public meeting. Please note that because of the confidential nature of the annex to document EB 152/55, it is available only to member states. It has been sent under confidential electronic cover to board members and the heads of member state delegations. Do I take it that the board agrees with these proposals? As I see no objection, it is so decided. When delivering statements, I would like to remind delegates to speak at a moderate speed that allows for its interpretation and ensures their message is conveyed clearly and accurately. Please send a copy of your written statements in advance to the email address interpret@who.int. This does not prevent you from making changes on delivery, but will facilitate clarity and accuracy in all languages. This concludes our consideration of agenda item 1. I think we are proceeding well. Let us now consider item 2 of our agenda, report by the Director General. It is my pleasure to give you the floor, Director General. You have the floor.
This is the story of health. No, it's not just about eating your vegetables and growing taller. It's about how the world's people came together to help us all live long and healthy lives, making amazing discoveries like new medicines and vaccines, guiding us to grow up healthy, strong, and happy, keeping us safe from nasty diseases, painful ones, and deadly ones, and some horrible ones you've never heard of because they were completely wiped out.
The end of smallpox, the magnificent chapter in international collaboration.
Long-awaited malaria vaccine is a breakthrough for science.
Has finally been declared free of wild poliovirus.
It was really a story of human perseverance, innovation, commitment, bringing communities together towards one unified goal.
This is a story about all of us because we all played a role. And if we can keep working together, we'll make more discoveries, have more victories over diseases, and help even more people be healthy and happy in the future.
Thank you. I think we should repeat that video maybe at the end of my speech. It's a very nice one. A very smart girl, actually. Was not clear when it started, so a repeat will be important. Dr. Kristen Vesna Petric, Chair of the Executive Board, Excellencies, Ministers, Heads of Delegation, dear colleagues and friends. Good morning to all of you and a very happy New Year. 3 years ago today, I declared public health emergency of international concern over the global spread of COVID-19, the highest level of alarm under the international health regulations, and for the moment, the only level of alarm. As you know, on Friday, the Emergency Committee met to consider whether that remains the case. The committee has advised me that, in its view, COVID-19 remains a global health emergency, and I agree. As we enter the 4th year of the pandemic, there is no doubt we're in a far better situation now than we were a year ago, when the Omicron wave was at its peak. But since the beginning of December, weekly reported deaths have been rising. In the past 8 weeks, more than 170,000 people have lost their lives to COVID-19. And that's just the reported deaths. We know the actual number is much higher. We can't control the virus, but we can do more to address the vulnerabilities in populations and health systems. That means vaccinating 100% of the most at-risk groups. It means increasing access to testing and early antiviral use. It means taking context-specific measures when there is a surge in cases. It means maintaining and expanding laboratory networks. And it means fighting misinformation. We remain hopeful that in the coming year, the world will transition to a new phase in which we reduce hospitalizations and deaths to the lowest possible level, and health systems are able to manage COVID-19 in an integrated and sustainable way. Vaccination will remain an essential part of our approach. We're now working to determine the most effective mechanism for advising member states and manufacturers on vaccine composition and vaccine frequency. At the Executive Board last year, I laid out 5 priorities for the coming 5 years as we work together to reinvigorate progress towards the 13th General Program of Work, the triple billion targets, and the health-related SDGs. Those priorities have since crystallized into what we're calling the 5 Ps: promoting, providing, protecting, powering, and performing for health. I wish to be very clear that the 5 Ps in no way replace the GPW or the triple billion targets, which remain the organization's guiding strategy. Rather, the 5 Ps are completely aligned with and contained within the GPW. All we have done is to draw them out of the GPW and package them in a way that highlights the key priorities on which we as one WHO, member states, and the Secretariat together must focus to accelerate towards the triple billion targets and the SDGs. Allow me to highlight some key achievements in 2022 against each of the 5 Ps, and by implication, the triple billion targets. First, promoting health by addressing the root cause of disease, which is essential for achieving our target of seeing the 1 billion more people enjoying better health and well-being. On tobacco control, we reached our target last year to support 100 million tobacco users to quit, but there are still an estimated 600 million users who want to quit and need our support. On trans fat, we have seen an almost 5-fold increase in the number of people protected by WHO recommended policies on the use of industrially produced trans fat, from 550 million people to 2.6 billion in just 4 years. But as you know, still 5 billion are unprotected, even if we protect 2.6 billion. Every year, more and more countries either increase or introduce a new health tax. For example, with support from WHO, Timor-Leste last year increased its tax on tobacco 5-fold, increased tax on alcohol, and introduced new taxes on sugar and sugary drinks. On maternal and newborn care, exclusive breastfeeding in infants under 6 months has increased from 38% to 48% globally over the past 10 years, bringing us very close to the target of 50% by 2025. We also reviewed evidence from trials in 20 countries that showed for the first time that immediate skin-to-skin care or kangaroo mother care can save almost 1/3 of children born preterm. On our efforts to make the world's roads safer, with WHO support and leadership, the UN General Assembly last year held its first high-level meeting on road safety. We also supported many countries directly, such as the adoption of new road safety legislation in Mexico and the development of a national road safety plan in Thailand, 2 countries with some of the world's highest rates of road fatalities. In our work against the health impacts of climate change at COP27 in Egypt, we launched the Alliance on Transformative Action on Climate Change and Health, which is supporting 63 countries to build climate-resilient and sustainable health systems. For example, in Mozambique, one of the most vulnerable countries in the world to the impacts of climate change, WHO has strengthened the Ministry of Health's capacity to monitor climate risks and impacts and to coordinate adaptation efforts. On aging, we led 12-country studies on the impact of aging on revenue generation for health, giving member states better data and policy recommendations. And WHO standards for safe listening were adapted by Apple, Huawei, Samsung, and Sony, enabling billions of people to take action to prevent hearing loss. The second priority is providing health. By reorienting health systems towards primary health care, which is essential for reaching our target to see 1 billion more people benefiting from universal health coverage. Last year, the special program on primary health care provided technical assistance to 119 countries hand in hand with ministries of health to strengthen the foundations of health systems. We continued supporting countries to strengthen their health workforce, which is the backbone of every health system. With international partners, we developed a global roadmap to invest in national public health workforce capacity. We have also added 8 countries to the WHO Health Workforce Support and Safeguards list for a total of 55 countries that need additional protection against active international recruitment. We launched the Nursing and Midwifery Global Community of Practice with more than 6,500 members from 180 countries. And in the coming year, we plan to launch a global campaign to provide access to basic emergency care training for 25% of nurses and midwives from 25 countries by 2025. On health financing, based on WHO guidance, 49 countries changed policies to remove financial barriers to essential health services, especially for COVID-19. We continue to support member states to expand access to essential medicines, which is a pillar of universal health coverage. In 2022, WHO recognized regulatory systems in 6 member states: China, Egypt, Nigeria, the Republic of Korea, Singapore, and South Africa, as having achieved maturity level 3 or 4, which means a stable, well-functioning system or advanced performance. And we issued a major update to our guidelines for biosimilars, making these complex medicines easier to evaluate for regulators and ultimately facilitating greater access for patients. On antimicrobial resistance, the tripartite officially became the quadripartite with the addition of the UN Environment Programme. WHO supported the development of new international targets to address the use of antimicrobials in humans, animals, and agriculture. 127 countries are now gathering data on antimicrobial resistance and consumption through the GLASS surveillance system, and 170 countries have national action plans to guide multi-sectoral response to AMR. All of this work is helping to alleviate suffering and save lives from all causes of death, disease, and injury. Last year, we supported dozens of member states to restore essential health services disrupted during the pandemic, including for routine immunization, where we saw the largest sustained decline in childhood vaccination in 30 years. As a result, 25 million children missed out on life-saving vaccinations, and catching up is now one of our highest priorities. For example, with WHO support, the Democratic Republic of the Congo has not just restored its routine immunization program to pre-pandemic levels. It has increased coverage by 5%. On non-communicable diseases, we published a new guideline on hypertension, and through the WHO Hearts Technical Package, 7.5 million people in 31 countries have been correctly diagnosed and put on treatment. We aim to double that number this year. India, for example, won the UN Award on Primary Care for its hypertension control initiative, which, by implementing the Hearts package, has put 3.5 million people on treatment since 2018. On diabetes, member states adopted a set of global targets for the first time. And on cancer, we have supported 65 countries to improve access to quality care as part of the WHO Global Initiative for Childhood Cancer, a 50% increase from 2021. This year, we plan to provide medicines for all children with cancer in 6 countries, with the goal of reaching 50 countries by 2027. Last year, WHO also supported multiple countries to develop national plans for cervical cancer elimination, including Maldives, Rwanda, Sri Lanka, and more. We're also making very encouraging progress on mental health. The WHO Special Initiative for Mental Health has now been implemented in 9 countries, expanding access to mental health services for more than 5 million people in Argentina, Bangladesh, Ghana, Jordan, Nepal, Philippines, Paraguay, Ukraine, and Zimbabwe. On communicable diseases, the COVID-19 pandemic was a severe setback, but in the past year, we have seen encouraging signs. On malaria, after increasing in 2020, the number of annual deaths appears to have stabilized, and cases increased at a slower rate. Meanwhile, the world's first malaria vaccine, RTS-S, is saving lives. In Ghana, Kenya, and Malawi, where more than 1.2 million children have now received the vaccine, we see a substantial decrease in hospitalizations for severe malaria and a more than 10% drop in child deaths. Following WHO's recommendation for widespread use of the vaccine, at least 28 more countries in Africa are planning to introduce it, starting this year. On tuberculosis, based on WHO recommendations published last year, 109 countries are now using the first fully oral treatment regimens for multi-drug resistance TB. Realizing our vision for ending TB, we require new vaccines. The only vaccines we have, BCG, is 100 years old and does not adequately protect adults and adolescents. More than 16 candidate vaccines are in clinical development, and just 2 weeks ago, we established a ministerial-level TB Vaccine Acceleration Council to bring new vaccines to people as quickly as possible. On HIV, last year we published new guidelines on the use of long-acting injectables for preventing HIV, a potential game changer for those most at risk. So far, 4 countries have approved the use of long-acting injectables, and 10 are conducting implementation studies. The medicines patent pool has negotiated a voluntary license, and soon at least 3 generic manufacturers will start production. And every year, more countries eliminate more diseases. As we mark World NTD Day today, we can be proud that in 2022, 8 countries were validated or certified for eliminating a neglected tropical disease: DRC, Equatorial Guinea, Malawi, Rwanda, Saudi Arabia, Togo, Uganda, and Vanuatu. Egypt also eliminated measles and rubella, and Oman eliminated mother-to-child transmission of HIV and syphilis. The third priority is to protect health by strengthening the global architecture for health emergency preparedness, response, and resilience. In 2022, WHO responded to 72 graded emergencies across all regions, including 3 public health emergencies of international concern: outbreaks of Ebola and cholera, conflicts in Ethiopia, Syria, Ukraine, and Yemen, and humanitarian crisis in the Greater Horn of Africa, the Sahel, and much more. Thanks to the generosity of donors to the Contingency Fund for Emergencies, we were able to release more than $87 million immediately to support rapid response. And we delivered essential health supplies to 90 countries from our Dubai logistics hub in the United Arab Emirates. Last year, we also launched the first consolidated WHO Global Health Emergency Appeal. And just last week, we launched this year's appeal for $2.5 billion. Of course, WHO does not act alone. In 2022, we worked with thousands of partners through the Health Cluster, GORN, emergency medical teams, and more. We continue to work with partners in building a rapidly deployable health emergency core for future health emergencies. We continue to support countries to respond to the COVID-19 pandemic with up-to-date technical guidance, training, and support for health workers, convening experts to advance science, and much more. Through our partnerships in the ACT Accelerator and COVAX, we supported the provision of more than 1 billion vaccines and procured 320,000 courses of antivirals. The number of countries with less than 10% of vaccination coverage reduced from 34 at the beginning of last year to 9, averting thousands of hospitalizations and deaths. In July, I declared a public health emergency of international concern over the global outbreak of Mpox. In total, more than 85,000 cases and 86 deaths have been reported to WHO from 110 countries. The number of weekly reported cases of Mpox has now declined significantly, although 36 countries in all 6 regions continue to report new cases. In September, the government of Uganda declared an Ebola outbreak. Working with many partners, we supported the government to respond to and extinguish the outbreak. During the outbreak, WHO's R&D blueprint for epidemics, working with the Ministry of Health and Ugandan researchers, coordinated a global coalition of partners to accelerate the availability of investigational doses of 3 candidate vaccines and rapid preparation for the integration of vaccine research in the response. Last year also saw an unprecedented number of cholera outbreaks reported in 30 countries, with a massive increase in the number of people with affected countries who are now at risk. In response, WHO supported large-scale vaccination campaigns and provided cholera kits to treat more than 500,000 people. In Haiti, one of the worst affected countries, WHO PAHO has delivered more than 1 million doses of oral cholera vaccines, and almost 3/4 of those eligible have received 1 dose. We have now raised the global cholera crisis to grade 3 emergency, the highest level in our internal grading system due to the high case fatality, the potential for further spread, and severe limitations in vaccine supply. On polio eradication, after an all-time low of just 5 wild polio virus cases in 2021, we saw an increase last year with 20 cases in Pakistan, 2 in Afghanistan, and 8 in Mozambique. However, no cases of wild poliovirus have been reported since early September last year. In addition, last year, 3 million children previously inaccessible in Afghanistan received polio vaccines for the first time. And in October, donors pledged $2.6 billion to support the work of WHO and our partners to consign polio to history. At the same time, as part of the polio transition, we have integrated polio assets in more than 50 countries to support immunization, disease detection, and emergency response. As you know, last year the Secretariat reviewed more than 300 recommendations from multiple reviews on the future of preparedness and response to pandemics and other health emergencies. Based on that analysis, we made 10 key proposals for strengthening the global architecture for health emergency preparedness, response, and resilience. This includes actions for stronger governance, stronger financing, stronger systems and tools, and a stronger WHO. The framework will enable us to converge and align the many different activities and initiatives that member states, multilateral agencies, and others are undertaking. This is especially critical as member states begin negotiations on a zero draft of a legally binding pandemic accord, in addition to ongoing discussions on amendments to the international health regulations. In November, under the leadership of Indonesia's G20 presidency, a new pandemic fund was established at the World Bank, with WHO playing a central role, including as chair of the technical advisory panel. The WHO Hub for Pandemic and Epidemic Intelligence is now fully operational, and last year engaged with almost 250 institutions around the world to foster collaborative surveillance and intelligence. And 4 countries have now completed the pilot phase of the Universal Health and Preparedness Review: Central African Republic, Iraq, Portugal, and Thailand. We're also now convening a process to create an end-to-end platform for equitable access to medical countermeasures, building on the lessons from the ACT Accelerator, the PIP framework, and other mechanisms. The 4th and 5th priorities are enablers of the first 3 and the triple billion targets. The 4th is to power health by harnessing research, innovation, data, digital technologies, and partnerships. On research, we established a grant program for young researchers from low and middle-income countries on NCDs. 8 were chosen from Cameroon, China, Egypt, Ethiopia, India, Peru, and Uganda. We also created a behavioral science unit which has run training in 4 regions, provided technical assistance for pilot projects in several countries, and contributed to our work on AMR and nutrition. On innovation, the mRNA Hub in South Africa has started transferring technology to manufacturers in 15 countries and the biomedical training in Korea. And we launched a mobile app developed for health workers in humanitarian emergencies to improve delivery of WHO child health recommendations. On data, we complete the beta version of the World Health Data Hub, providing a single source for publishing health data, addressing the fragmentation problems we had. The Data Hub will be made publicly available this year. And 76 countries are now actively implementing the 11th edition of the International Classification of Diseases, providing better data to support better policy decisions. On digital health, with support from WHO, more than 120 member states have developed national digital health strategies to guide their health system transformation. We have provided training for 600 health leaders in 103 countries on digital health strategy, governance, and implementation. And our leadership led to a global consensus on a technical interoperability standard for COVID-19 certificates, which are now in use by over 120 countries, enabling over 3 billion people to use digitally augmented vaccine and test results. On partnerships, last year we held civil society dialogues on climate and health, MPOX, UHPR, TB, sexual misconduct, and more, and working to establish the Civil Society Commission before the Assembly. We engaged with parliaments and the private sector. And just this weekend, we held the first meeting of the WHO Youth Council. Yesterday, the delegates briefed me on their proposals to accelerate progress on UHC, NCDs, mental health, and youth leadership. And I would like to join our chair, Dr. Petrich, to encourage all member states to meet our youth there in the compound, at least for today, if there are issues you would like to discuss. But at the same time, we ask you to include youth representatives in your delegations to the World Health Assembly. And also, we expect gender parity also of the delegation to the Assembly. And our partnership with Qatar and FIFA enabled us to reach billions of people globally with messages about physical activity and more during the World Cup in November in Qatar. And that's the first time, and learned a lot, and a successful one. The fifth and final priority is to perform for health by building a stronger WHO that delivers results and is enabled and empowered to play its leading role in global health. As member states, you look to us to provide world-class evidence-based norms, standards, research data, and technical and operational support. And that's what we're doing. Last year, we produced 213 global public health goods, including key reports and guidelines on artificial intelligence, disabilities, marketing of milk formula products, oral health, physical activity, priority pathogens, refugees and migrant health, safe abortion, and much more. In addition, the WHO Science Council published its first report on accelerating access to genomics for global health. Through our open WHO learning platform, 7.5 million learners from all member states accessed 190 courses in 67 languages. Open WHO will be an important part of the new WHO Academy, which will play a key role in building the capacity of the global health workforce, including WHO's own staff. We have now finalized an updated business model for the Academy and are developing a catalog of courses that respond to major global health challenges and the needs of health workers. With the strong support of France and other member states, the Academy is mobilizing new resources to ensure its sustainable financing, and we expect the Academy Campus Hub in Lyon to open its doors in September 2024. We're committed not only to building an even more experienced, qualified, and talented WHO workforce, but also to creating a workplace that allows our people to be and do their best. For a decade, WHO has given special attention to fostering a workplace where all staff are respected, enabled, and protected through the Respectful Workplace Initiative and related efforts on diversity, equity, and inclusion, mental health at work, flexible working arrangements, and more. From 2023, this initiative will transform into a dedicated program with fixed staff and resources to focus on sustained cultural change. Recognizing that talent is universal, but opportunity is not, we're launching the Young Professional Program to give junior professionals from least developed countries the opportunity to work with WHO for 2 years, then take the experience they have gained back to their countries. The first round has been completed with 14 young professionals recruited from Afghanistan, Bangladesh, Bhutan, Chad, Sudan, Madagascar, Malawi, Myanmar, Nepal, Senegal, Sierra Leone, Tanzania, Uganda, and Zambia. This program started in partnership with Buffett Foundation. I'd like to thank Buffett Foundation, and Professor Sennait is with us today. And I believe this program, if expanded, will be a game changer that helps, especially the low-income countries, to build capacity. And we will take more young professionals to have a stay with us for at least 2 years to build capacity and back home to better serve their countries. Last year, we also took strong action on mainstreaming gender in our work by developing an internal policy and strategy, updating our gender parity policy, and championing gender equality, human rights, and equity, both internally and externally. Programs such as polio and health emergencies now have specific programmatic strategies to promote gender equality, which are strengthening our country operations. And for the first time in WHO history, we have reached overall gender parity for staff across all appointment types and categories of positions. As you know, 2022 was a landmark year for our work, for our organization, with the agreement by member states to increase assessed contribution to 50% of the base budget over the next decade. The program budget for the next biennium, which you will consider this week, includes the first increase in assessed contributions, if approved, of $200 million. This is also the program budget in which country office will be allocated more than half of the total budget of the biennium. Strengthening our country offices is a key priority. For the past 3 weeks, 6 country representatives have been working to develop a 100-day plan of action in 7 critical areas, including core presence in country offices, rotation and mobility, adequate and predictable financing, delegation of authority, and more. Some of these actions are already underway through the transformation, and others will be implemented immediately after the plan of action is finalized and agreed. To support this initiative, in the coming year, we will be working closely with 45 country offices using a delivery for impact approach to focus on the highest priority, highest impact interventions. As a complement to the increase in the assessed contributions, the Secretariat is also proposing a new replenishment process which we will submit to member states for consideration. We recognize that with increased flexibility and sustainability comes increased expectations for transparency, efficiency, compliance, and accountability, meaning all this leading to result. As you know, we have made progress on preventing and responding to sexual misconduct, and I will have more to say about our ongoing work in this area when we address the agenda item. I thank the Agile Member States Task Group for its recommendations, which have been incorporated into the monitoring mechanism to track progress on the Secretariat's implementation plan on reform. The implementation plan contains 98 actions, 38 of which have already been completed. We will continue to implement the remaining actions, and we look forward to the board's support and continued oversight. We appreciate, as you do, the delicate balance between the governance role of member states and the management responsibilities of the Secretariat. We all want a WHO that's agile, proactive, and able to move quickly to respond to global health threats. The Secretariat is committed to implementing the priorities and plans of member states as agreed at the World Health Assembly. In turn, we ask member states to give the Secretariat the necessary latitude to carry out our mandate to achieve those priorities and plans. Excellencies, I have tried to give you a taste of the huge scale and scope of work that your organization does and that your agenda this week reflects. But it's only a test. I have barely scratched the surface. It's impossible to do justice to the work we're doing around the world. And none of it is possible without the people who make WHO what it is. I do not have the words to express my gratitude, admiration, and respect for my colleagues, staff, consultants, contractors, JPOs, and interns, G staff, P staff, which I don't like the division, directors, assistant director generals, executive directors, and regional directors, from the front lines to the back office, in mega cities and remote islands, working on the big picture and the small details. As you know, this year marks our organization's 75th anniversary. This anniversary belongs to all of us, to every member state, and to every member of staff. This is our opportunity to tell our story and imagine our future. Accordingly, I have asked every country and regional office to design a localized campaign to celebrate WHO's achievements in every corner of the world. We have a lot to be proud of over the past 75 years. But it's not the past 75 years that matters. It's the next 75. Not the past 5 years, but the next 5. Not yesterday, but tomorrow. We look back with pride so that we can look forward with hope. We learn the lessons of the past so we can apply them in the future. Thank you for your confidence and trust. We're proud to be WHO, proud to be your WHO. I thank you. Maybe if we can have the video with your permission, Madam Chair. It's a very short one.
Since 1948, thanks to the diversity and the commitment of its 194 member states, the World Health Organization has had a profound impact on improving the health of human beings around the world. The collective work of WHO member states has led to the eradication of smallpox. The Framework Convention on Tobacco
It helps with the phones, headphones.
WHO Framework Convention on Tobacco Control are adopted. And the
The International Health Regulations.
Se adopta la resolución y por consiguiente se aprueba el tercer informe de la Comisión A.
And the decision to establish an intergovernmental negotiating body to develop an instrument for pandemic prevention, preparedness, and response. So, how do member states work together to achieve tangible results? The World Health Assembly, or WHA, is the decision-making body of WHO and is comprised of its member states and associate members. In May, all delegates come together to lead the way. They agree on WHO policies, approve its budget and priorities, and every 5 years, they appoint the Director General of WHO.
Appoints Dr. Tedros Adhanom Ghebreyesus as Director General of the World Health Organization.
The Executive Board, also known as the EB, acts as an executive body to prepare and support the work of the WHA. The WHA and the EB adopt resolutions which offer the collective recommendations of the member states. How did WHO member states respond to the disruption and tragedy of the COVID-19 pandemic? With nearly triple the number of intergovernmental processes to work through, member states worked day and night, making vital decisions that would improve the lives of billions. Strengthening preparedness and response to health emergencies became an urgent need. WHO member states have worked tirelessly towards a pandemic instrument, as well as filling gaps from the international health regulations of 2005. Finally, they decided to strengthen WHO's governance and financing to better serve those who need it most. The dedication of WHO delegates to the advancement of human health is remarkable, finding common ground between the visions of 194 member states as they continue across generations, geographies, time zones, cultures, and languages.
Happy 75th anniversary to the World Health Organization. We, member states, and the Secretariat make our organization strong.
We are WHO.
Thank you, Dr. Tedros. Thank you for such an excellent report. I think we are all impressed. And actually, I think we are all impressed what has been done, not only by Secretariat, but by all of us, member states, partners, together. It's really important to understand the strength of this. Also, thank you very much for paying so much attention to the young people. They are our future, we all know, but they are also the ones that can think out of the box, being so innocent still. And I think we should consider them as a very important partner. And thank you, I have to say this since I'm a woman, to pay so much attention to women as well. Thank you very much. I think that we now can open the floor for discussions. And kindly, please, raise your nameplate should you wish to take the floor. I see Denmark. Denmark, the floor is yours.
Thank you very much, Madam Chair, Director General, fellow members of